What's up, guys? Welcome to part 3 of my cancer journey that ultimately led to Infinite Motive. I'm Sunny with Infinite Motive, and to pick up where I was last time on part 2 was that basically I was finishing up treatment at Summerlin Hospital, needed to find where I was going to start what's called consolidation therapy, and all roads led back to MD Anderson being the number one choice. My sister and her husband's medical expert friends all said that MD Anderson was the best place to go. My mom's research led back to the same result, and upon getting there I realized just how much on a different level this place was and is. So we ended up packing up the house, heading out there, and began basically, and they have apartments that are pre-decorated for people that are traveling to the medical center, knowing that they're uprooting their lives and don't have any means. So we started at a location like that. I met with who my oncologist would be out there. Initially it was Dr. Ravandi, and he had discussed a treatment plan with me and my family that would ultimately be, the goal was to beat this without having to do bone marrow transplant, but knowing that that could be a possibility as treatment progressed, depending on how my body responded to everything. The idea was to get 4 consolidation rounds of chemotherapy. I started with, basically right off the bat, was a clinical trial called gemtuzumab that would be paired with my treatment of cytarabine, high-dose cytarabine. And the treatment plan was, like I said, 4 rounds of this would hopefully knock out the cancer completely and avoid us having to look into a bone marrow transplant. The other thing that happened upon arrival was I had a bone marrow biopsy to find what kind of mutation we were working with, just because there's tons of different mutations with leukemia, and depending on which one you have, it alters the treatment that they're going to be giving you. And that would be crucial, and we didn't understand how important at the time that would be, but my mutation came back as CEBPA and TET2, combination of those two, and the outlook or prognosis was I'd say medium as far as survival rate goes for it. It also highlights the importance of going to a very decorated medical center like MD Anderson, because these are types of mutations that couldn't have been picked up by the medical team that I had in Las Vegas. That's not a knock against them, it's just, you have the resources you have, the knowledge you have, and the number of patients that you're dealing with. That number at MD Anderson, the number one cancer center in the world, is going to way outweigh Summerlin Hospital and what they've seen there. And due to that and all the studies and research that they're able to do there, they have resources that are enabling them to be able to find out way more details about the disease and way more effective ways of being able to treat it. So that was great to be able to know more details about what we're dealing with and not just guessing with, all these rounds of chemotherapy and hoping for the best. The treatment plan, like I said, 4 rounds. I started with my first rounds April of 2019. I was hospitalized for over a week. I ended up, the biggest thing that people don't anticipate with these rounds of chemo is you think that you're just going to be dealing with the side effects of the chemotherapy as it's being given to you. But what actually ends up happening is that after you receive the chemo and your inpatient stay in the hospital, you will experience some side effects, but really what happens and brings you down to the very lowest point is what happens afterwards when you go home. This period of time is called the nadir. It's when your counts are at their lowest. You're going to be feeling your worst during this time period, and it's for anybody that would go through it, you would imagine that because you're feeling so terrible, you get to just stay home, stay laying down. The opposite is actually true. What you end up having to do is, we were at MD Anderson, leaving at 5 a.m. every morning to go get blood work done. This blood work would track what levels obviously my blood and platelets are, but it would also track whether or not I needed a transfusion of either blood or platelets. And the reason for starting the morning so early is because if you are on a waiting list to get these transfusions, you could be looking at a full day and even a late night if you're not one of the early ones getting in there, getting tested and finding out what you need. We learned this lesson early on, spent a couple days that went way too long into the night, and we decided, okay, as torturous as it is to wake up this early and be feeling this way and go and get your blood done, the benefit is you get to go home at a better time, and that made it worth it. The process of having to go get blood every morning at 5 a.m. is mentally challenging and exhausting, and it will test you like nothing else. And it goes back to the same tactics I was talking about before, with just really trying to focus on the positives and one foot in front of the other, and not zooming out and looking at what this treatment plan entails in its entirety, because then it can become unbearable, and that's when you can really start to lose yourself. I had this first round and started to experience extreme light sensitivity. I had severe headaches, prolonged bleeding. When I say bleeding, what ends up happening is your platelet levels go so low that you will start to experience having red marks all over your body. That's a sign of low platelets. I started having mouth sores. You have very little that you can do to aid this. There's things like biotin, things to keep your mouth from getting too dried out. But ultimately, this is just part of the reaction of your body to the chemotherapy. After the first, I actually have all of this listed, and it's a wall of information, so excuse me as I scroll through this. I had experienced every side effect possible, and after you recover and your counts start to recover, you still end up having to do another round, and it's hard to mentally gear up for what is a hospital stay that feels like a hotel. You're checking in, you have all your bags, and you know that you're going to be there for a prolonged period of time. You are stuck with what's available there, food-wise, entertainment-wise. You know that you can't leave the floor because of how low your immune system's operability is. You are going to be left to just walking the floors to get your for your respiratory strength, and the entertainment is those around you and your caretaker, who luckily for me was my mom, that was staying with me at all times. And again, I was very fortunate that while she stayed with me at the hospital, my dad was able to take care of things back at home. We had a little dog named Chief, who was infinitely important to me and my family getting through this as well. Things like that can play a huge role in keeping spirits up, even when I'm not able to, touch my dog and pet him and spend time with him because of my immune system, even at a distance. And what he provided for my parents, as just keeping everybody's spirits up, was very important. As I went into the second round of chemo, I experienced severe side effects. Of course, when it rains, it pours. So during this time, my grandma unfortunately passed away, and this is my father's mom. He flew out there to go to the funeral and obviously deal with the entire situation. As this was taking place, I'm getting terrible side effects from the second round of chemo. I experienced rigors to the point where I'm shaking uncontrollably and my mom's trying to hold me down. We ended up going to the hospital for what I believe was another 2-week stay that was aside from my chemotherapy stays. This is just from the infection. This infection ultimately led to me getting sepsis. My body was just starting to deteriorate at a fast rate. I had a high temperature, had to be hospitalized. Low blood pressure, and even experiencing just up and down in terms of my heart rate would spike to abnormal levels, everything in between. I ultimately got it treated well enough that I was able to push through to further rounds of chemo. That experience alone was a haunting experience. It didn't seem like there was any light at the end of the tunnel at that point. Things really seemed to be closing in on me. It didn't seem like anything was working. It's hard to stay confident in the treatment plan when every single treatment you have, you end up hospitalized again with another infection, and staying positive during a time where things are already so bad on this end, and then you have a loved one pass away on the other, is just it really highlights how life doesn't stop just because you are going through something so dark. There's going to be other things that happen that might not even rise to that level, but everything is going to seem like a world ender during that time, just because you're already suffering so much, and you will continue to go through outside issues as well, whether it be insurance issues or other family friend issues, social issues, significant others, loved ones, etc. It's unfortunately just part of the journey, and it's going to be what tests you mentally, and you will have to show fortitude to persevere. That was the second round of chemo that I had that sepsis. The third round again went through same situation. I was hospitalized again due to infection afterwards. My counts were just not recovering as well this time. At this point, my body had gone through so many rounds of chemo that it was just, and the gemtuzumab, which was the clinical trial that I took in the first round, had taken a heavy toll on my liver, which they had told me it was a high possibility that I would never be able to drink again because my liver would be damaged from this medication, but that it was necessary for not allowing relapse, ideally. This was obviously disappointing because you expect to start seeing some recovery in your counts blood-wise, and you don't see any progress on that end. The flip side of that is that there wasn't any cancer returning at the time either, and ultimately we got together with Dr. Rabandi to determine whether a fourth round would actually be beneficial at all, and we came to the conclusion that there was no sign that a fourth round would give me better odds of not having a relapse, and it would damage my body significantly more. So we didn't find it worthy of going through a fourth consolidation round, just given the circumstances and my counts not returning. That would lead to us basically saying that I was in remission. Technically, there was no residual sign of disease, and by all numbers on the paper, I didn't have cancer anymore. This would be challenging for me mentally because it didn't feel like I was finished. It didn't feel like I had really completed anything. It felt like I had been poisoned repeatedly and reduced to nothing. And then they say, okay, well, now we can try to let you back out into whatever semblance of a normal life you have left. This would lead to us scheduling to go visit family in California, see everybody. Of course, this was with a undertone of it was a celebratory occasion. I'm done with cancer. I'm in remission. We celebrated with family. I had told my mom multiple times that I had this feeling that it just wasn't done yet, and that the odds of me relapsing were pretty high, and I felt like there was it felt difficult to celebrate something like that, knowing that there's this pretty solid chance that it could come back, and mentally that would lead to, I know I've discussed before, imposter syndrome, and feeling like I didn't quite reach the level, which I know to somebody that hears this generally, I'm sure it sounds crazy after everything I've told you story-wise of what led to this, but it felt like I hadn't really done the full, I don't want to say experience, but I hadn't taken all the steps in terms of fighting cancer compared to who or what, I don't even know. To those that had gotten transplants or more rounds, I really don't know. It's a mental thing, and I knew that going and celebrating this, I had to put on the smiles, and everybody in the family is obviously very elated and happy for me, and it was a celebratory time. Shortly thereafter, I got sick again, got my blood work done, and of course it showed that the cancer was returning, and at that point there was no other option other than doing a bone marrow transplant. And I think that since that was pretty heavy and quite a bit of information, I'm going to leave it there for part 3, and in part 4 I will discuss bone marrow transplant, the details behind how that went down, and what the steps were from there forward. I think to kind of sum it all up, the most important parts that I want to get across are that MD Anderson is a cut above the rest. It's a medical facility. I'd say it's practically a medical city that is performing at the highest levels medically, be it through research, through the treatment that you receive there of the professionals. The facilities, like I said, are next level compared to where I came from in Vegas, and I've heard this multiple times from people that have come from all over the world. So I know that it's definitely the place that I would recommend immediately to anybody that's going through cancer. It would be, the number one goal would be to getting there to get your treatment, if at all possible, if insurance allows. Obviously there's a lot of variables involved, but that would be my number one recommendation. And like I said, them being able to have the resources to know that I have a certain type of mutation and that this is how it needs to be treated for the best chance of survival, you can't ask for more than that. The people there are unbelievably friendly. They are all looking to help. As soon as we got there, when we didn't know where something was, they can tell when you're lost, and they're right on top of just making sure that you get to where you need to go. They have every resource available that you could possibly need, and I was fortunate enough to have a living situation where, like I said before, my sister and her husband were already out there, so we were able to live in a community with them, be close, and have those conveniences, which is ironic to say when it comes to something like cancer, but those things are priceless when it comes to dealing with something so heavy. Like I said, basically MD Anderson's the number one place. I went through this journey. The consolidation was hell, and I would never wish it upon anybody, but this process is what allowed me to get to the next step, which I'll cover in part 4. I thank you guys for following along. I hope this provides as much information to people that are going through it or know somebody that's going through it as possible. I hope that you like, share, and comment. Tell us your story. Tell us what you think. Any comments are appreciated, and I'll see you guys for part 4. Thanks so much. Have a good one.